All right, awesome. Well, thank you so much for having me here. And hi, everyone. My name is Vincent Lai. I am a third year or rising third year graduate student at Rice University doing my PhD in psychology and in Houston, Texas. So I'm really excited to be talking to you today about a project that I've been doing and just my research looking at something called the fear of missing out and how it impacts mental health. So imagine a situation where you and your friends are really excited to go out to a get together, like a party or a dinner. But when you're about to go, you realize that, uh-oh, you have to study for a test or finish a paper or project. And so while you end up having to stay in and do whatever it is you're supposed to be doing, you see that all your friends are out having fun at this party or dinner or event. How would you feel? When in this and similar situations, many people report experiencing something called the fear of missing out, or FOMO for short. And so, what exactly is FOMO? FOMO is defined as feelings of apprehension that you might experience when aware that others might be having rewarding and exciting experiences from which you're absent. And FOMO first began as a buzzword in the popular vernacular. So you might have heard about it like in conversation or just seeing it on like a pop sci article, for example. But especially in the past decade, researchers have recently started to study FOMO as a psychological phenomenon. And so a growing body of research shows that FOMO is linked to worsening mental health outcomes. So for example, people who report experiencing more FOMO also report more symptoms of depression, feeling more stressed out, feeling lonelier compared to those who might experience less FOMO. And so now I'll go over a study as well as findings from a project that I did for my senior honors thesis that was recently published in the Journal of Social and Personality Psychology Compass. The information is right there. And I'm going to go ahead and go through the study details with you. And so, kind of backtracking to the early stages of the COVID-19 pandemic, we remember that in many places there were these lockdowns and social distancing measures that were designed to mitigate the spread of the COVID-19 virus. However, these measures also led to people literally missing out on really important social and life experiences. And this ranged from anything from day-to-day social gatherings to major life milestones. People missed out on weddings, birthday parties, baby showers, graduations. And in particular, people who were at risk for the severe consequences of COVID-19 infection, such as hospitalization or death, may have been especially impacted because these people might have had to adhere more strictly to these guidelines in order to protect themselves and those around them from being infected with COVID-19. And so our big research question coming into the pandemic and into our research is whether FOMO was associated with worsening mental health outcomes, specifically depressive symptoms, among those at risk for severe health consequences of COVID-19 infection, such as hospitalization. And so to do this, we conducted an online study where we first had participants complete an online eligibility screening form. And in order to be eligible to participate in our study, participants must have been able to read and write in English, have an underlying medical condition defined by the World Health Organization, such as a cardiovascular condition, cancer, inflammatory diseases, and so on, or be at least 60 years of age, as that would put them at risk for the severe consequences of COVID infection alone. And of course, participants who had both an underlying medical condition and who were at least 60 years of age were eligible as well to participate. And so once participants were considered to be eligible, they received a series of questionnaires. And so looking at our sample, we had a sample of 76 participants, 55 of which identified as female and 21 male. Most of our participants were older adults. So on average, participants were about 69 years of age, and we had a sample that consisted of predominantly white identifying participants. And so after being considered eligible, participants received a link to a series of questionnaires, which was considered their time one. This was what they took immediately after the survey. And they also received a series of questionnaires about 1 week after. And this was considered their follow-up questionnaires. And so what we found was that cross-sectionally at time one, FOMO was positively associated with depressive symptoms, meaning that people who reported greater FOMO also reported more symptoms of depression. And we found that this held even when we accounted for the potential influences of other social variables on depressive symptoms during this time. So we statistically accounted for how generally stressed people were feeling, how lonely people were feeling, and how worried people were about getting infected from COVID-19. And we found that FOMO continued to be significantly associated with depressive symptoms during this time, even after accounting for those other important social variables. And so kind of looking forward as to what's next for this line of work. So because our data were cross-sectional, we weren't able to sort of say what was causing the others. So, FOMO could have been leading to depressive symptoms, but it could have been people who were more depressed might be experiencing more FOMO during this time. And so future studies may kind of investigate the potential causal links between those two variables. Additionally, this study shows that FOMO is more than just a young people problem. FOMO has been largely studied in the context of social media usage, internet usage, and looked at in adolescents and younger adults, as these people are more likely to be using those platforms and more likely to experience FOMO. However, our study shows that older adults also significantly experience FOMO, as well as it's linked to worsening mental health in this population. And then lastly, as part of my own research, I'm interested in looking at the potential links between FOMO and physical health. So in summary, FOMO involves feelings that others might be having reporting experiences from which one is not present. We found that among those at risk for severe COVID-19 infection, that FOMO was an important associate with depressive symptoms during this stressful time. And of course, as I mentioned, future research should better investigate the links between FOMO and mental health. I know I'm getting close on time, so I just want to give a thanks to my advisor, my lab, for all of their support and encouragement. I would not be there without them. Thank you so much for your attention.